completed at 5E. Child was referred by another doctor, another ophthalmologist. ಇನ್ನೊಬ್ರು ಕಣ್ಣಿನ ಡಾಕ್ಟರ್ ನೋಡಿದ್ದು. ಅದೇನಾಯಿತು ಅಂದರೆ ಈ ಪೇರೆಂಟ್ಸು ಮಗುನ ನೋಡಿದಾಗ ಹುಟ್ಟಿದ ಮಗುಗೇನೆ ಬಲ್ಗಣ್ಣಲ್ಲಿ ಪಾಪೆನಲ್ಲಿ ಬಿಳಿಯಾಗೇನೋ ಕಾಣಿಸ್ತಾ ಇತ್ತು. ಸೊ ಇದೇನೋ ಕಣ್ಣು ಬಿಳಿಯಾಗಿದೆಯಲ್ಲ ಅಂತ ಅವರು ಮನೆ ಹತ್ರ ಇರೋ ಡಾಕ್ಟ್ರು ಕಣ್ಣಿನ ಡಾಕ್ಟ್ರ್ ಹತ್ರ ತೋರಿಸಿದ್ರು. ಅವರು ಡಾಕ್ಟ್ರ್ ನೋಡ್ಬಿಟ್ಟು ಇದು ಮೋಸ್ಟ್ಲಿ ಪ್ರಾಬ್ಲಮ್ ಇದೆ, ಇಟ್ ಮೇ ಬಿ ಕ್ಯಾಟ್ರಾಕ್ಟ್. ಸೊ ನೀವು ಹೈಯರ್ ಸೆಂಟ್ರಿಗೆ ಹೋಗಿ ನೇತ್ರಧಾಮ ಹೋಗಿ ಅಂತ ಇಲ್ಲಿ ಕಳಿಸೋದು. ಯಾಕಂದರೆ ನಾವು ನೇತ್ರಧಾಮನಲ್ಲಿ ವಿ ಡು ಆಲ್ ದ ಕಾಂಪ್ಲೆಕ್ಸ್ ಕೇಸಸ್. ಬೇರೆ ಕಡೆ ಕೇಸ್ಗಳು ಮುಟ್ಟದೇ ಇರೋ ಕೇಸ್ಗಳು ಇಲ್ಲಿ ಬರುತ್ತೆ. ಸೊ ವಿ ಹ್ಯಾಂಡಲ್ ದಟ್. ಆ್ಯಂಡ್ ಈ ಪೀಡಿಯಾಟ್ರಿಕ್ ಕ್ಯಾಟ್ರಾಕ್ಟ್ಸು ನಾನು ಸುಮಾರು ಈಗ 30 ವರ್ಷದಿಂದ ಮಾಡ್ತಾಯಿದ್ದೀನಿ. ಸುಮಾರು ಮಕ್ಕಳು ನಾನು ಕ್ಯಾಟ್ರಾಕ್ಟ್ ಮಾಡಿರೋರೆಲ್ಲ ಈಗ ಡಾಕ್ಟರ್ಗಳೆಲ್ಲ ಆಗಿದ್ದಾರೆ. ಸೊ ಮಗು ಬಂದಾಗ ನೋಡಿದಾಗ ಬಲ್ಗಣ್ಣಲ್ಲಿ ವೈಟ್ ರಿಫ್ಲೆಕ್ಸ್ ಇತ್ತು, ಅಂದರೆ ಪಾಪೆನಲ್ಲಿ ಫುಲ್ ವೈಟ್ ಆಗಿತ್ತು. ಸೊ ಚಿಕ್ಕ ಮಗುನ ಎಕ್ಸಾಮಿನ್ ಮಾಡೋದು ಕಷ್ಟ, ಚೆಕಪ್ ಮಾಡೋದು ಕಷ್ಟ. ಸೊ ಅದು ಇಟ್ ನೀಡ್ಸ್ ಲಾಟ್ ಆಫ್ ಎಕ್ಸ್ಪರ್ಟೀಸ್ ಈವನ್ ಟು check the eyes.
Dr. Sri Ganesh, Chairman and Managing Director of Nethradhama Hospital. And today I want to share a very unique case. This was a 5-week-old baby with congenital cataract in one eye, which was referred to a hospital by another eye surgeon for treatment. The child was diagnosed as a congenital cataract. When the parents recognized that there was something wrong, they saw a white reflex in the eye and then took the child to their eye doctor, and the eye doctor suspected that it may be cataract or some other problem, so he referred to us to manage the case. Now the parents actually were very shocked, and in fact I would say they never expected that a child, a 5-week-old child, a newborn child can have congenital cataract. So they were very anxious, very apprehensive as to whether the child will get vision, whether surgery can be done. We had a lot of questions. It took almost an hour and a half to kind of counsel them about the problem, what the problem is, why the problem comes, how it can be treated, what are all the efforts involved, and post-op, what is the care that should be given, what is the duration, what is their role in the treatment. All this was counseled. And after that, the child was thoroughly investigated for any other congenital problems, and our anesthesia department did a full pre-anesthetic evaluation, and then we fixed the date for surgery. The surgery itself took about half an hour. Since it is a 6-week-old child, we decided to do the surgery in 2 stages. First stage is removing the cataract. The cataract was very dense and fibrous, so we had to actually remove, because it was completely blocking the light. We had to remove the cataract so that light enters the eye and the vision develops, because it's very important for 15 days to 3 months. That's when the fixation and vision develops in the brain. And if the cataract is there in only one eye, then they have very dense amblyopia. That means the vision in that eye is completely suppressed because the child prefers to use the other eye. So it's very important, especially for cataract in one eye, that the child be operated as early as possible. So we took up the child at 6 weeks for surgery, and the surgery went on very smoothly. We have removed the cataract and the child has recovered well. The child is fixating now, and then we are doing the patching and amblyopia therapy also. And with glasses, the child is able to see. Parents say that the child is able to reach out to objects and able to see, even mobile or TV. And at 6 to 8 months, we are planning to put an intraocular lens. It's a secondary intraocular lens which will restore the full vision for